Today's topic of discussion, chronic inflammation. What is chronic inflammation? It is an inflammation of prolonged duration. So prolonged duration, it will take weeks or month. And here three things takes place simultaneously. What are the three things? Inflammation, tissue injury, and attempt to repair. So three things is important here. They are inflammation, tissue injury, and attempts at repair, that is fibrosis. In varying combination, this inflammation, tissue injury, and attempt to repair, these are the hallmark of chronic inflammation. These three things are hallmark of chronic inflammation. So inflammation, tissue injury, and attempts at repair, these are the three important hallmark of chronic inflammation. Before going in detail and understand the pathogenesis of chronic inflammation, it is important to understand that basic two type of WBC, granulocytes and agranulocytes. Granulocytes means it have granules in their cytoplasm. Agranulocytes means does not have granules in the cytoplasm. So here that granulocytes are neutrophil, eosinophil and basophil. These agranulocytes example lymphocytes and monocytes. In this chronic inflammation, here we want to discuss these monocytes. Okay, discuss about that monocytes. That is here type of agranulocytes. Okay, so agranulocytes, monocytes is here type of agranulocytes. All WBC, the monocytes also formed in bone marrow. So all the WBC formation in bone marrow. So monocytes formation in the bone marrow only. In bone marrow, it is formed in the form of monoplast. In bone marrow, that formation of monocytes, this one in bone marrow, it have that name monoplast. Once it comes into the blood, it is known as monocytes. Once it comes into the blood, name is called monocytes. Once it have in the blood and come into that extra vascular space, that is the tissue. Once it reach to that tissue, okay, it is known as macrophages. And with the help of certain cytokines, okay, that is interferon gamma, these macrophages, okay, will converted to activated macrophages. It is also known as that activated macrophages is known as, what is the name? Epithelioid cell. So you understand the sequence of formation. So this one fused, these epithelioid cells fused and form giant cell. So this one is that overall outline. So what are the things in the bone marrow? The formation. So in the bone marrow, it is known as monoplast. In the blood, it is known as monocytes. In the tissue, particular organ, it is known as macrophages. Then with the help of certain type of cytokines, it become activated. Activated macrophages is known as epithelioid cell. Some epithelioid cell fused and form giant cells. It is the sequence of formation. So monoplast give rise to monocytes. Monocytes give rise to macrophages. Macrophages converted into epithelioid cell. That epithelioid cell fuses each other to form giant cell. In different human organ, the modified macrophages are named differently. For example, in brain, the modified macrophages are microglial cell. In lungs, the modified macrophages, dust cell or alveolar macrophages. In liver, they are known as Cooper cell. In spleen, they are known as littoral cell. In kidney, they are known as mesangial cell. Mesangial cell. In placenta, they are called as kappa your cell. Kappa your cell. Then synovium, type 1 cell or type A cell. In bone, osteoclast. These are the different names. So these are the different name given to modified macrophages in different organ. Let's start. First one is granulomatous inflammation. Acute inflammation having 11 steps, vascular event and cellular event. Here only 3 steps only. So first one is granulomatous inflammation. Granuloma inflammation. It is a special type. Okay, it is a special type of chronic inflammation. It is a special type of chronic inflammation. Pathogenesis of granulomatous inflammation, basically it's type 4 hypersensitivity. So here because of type 4 hypersensitivity, most important feature is that is poorly digestible antigens. Poorly digestible antigen enter human body. For example, Mycobacterium tuberculosis, it is the bacterium. Mycobacterium leprae, also bacterium. Some suture materials or particles of talcum powder. These all are non-degradable. So Mycobacterium tuberculosis, leprae, suture material and talcum powder. These are non degradable antigens. Say for example, this one is the antigen. It may be bacterium or suture material or talcum powder. So when this one is the antigen. Whenever non-degradable antigen enter to human body, so this one is the non-degradable antigen. This one enter to human body. The first cell interacted with them. So first cell, that cell name is called as antigen presenting cell. So this one is the antigen presenting cell. Okay, so it is a type of macrophages. This antigen presenting cell is a type of macrophages, but this antigen is the non-degradable antigen. So it interacting with this antigen. So this antigen presenting cell interacted with this antigen, and it helping that antigen try to degrade it. So try to degrade it, but it is unable to do so. That's why when it is failed or unable to do so, it will present the antigen. So this antigen presenting cell need help from T1 T helper 1 lymphocytes. Okay, so this one cannot destroy this antigen presenting cell cannot destroy this antigen, so it need help. So with the help of T helper cells, okay, so they will get activated, and activation they secreted 3 chemicals. So it need this T helper cell help, so it become activated. Now after that it secreted 3 chemicals. So it is secreted chemicals. What are the chemicals? Interferon gamma, interleukin 1 and 2, and tumor necrosis factor 2. These are the chemicals secreted by T helper cells. Now each of these cytokines, so these are the cytokines, will causes proliferation of one type of cell. So totally end we will be having 3 different type of cell which will form that granuloma. That end of the section we have 3 different type of cell. This one will form granuloma. Thus, first cell interferon gamma converted convert macrophages into modified macrophages. So it will converted normal macrophages into modified, that means activated macrophages, and form epithelioid cells. Okay, it form epithelioid cells, that is interferon gamma converter producing epithelioid cells. Interferon gamma will take out. How that formation will happen? So now it is secreted these chemicals. This one is the blood vessels. Take one, okay, take one cells out of that blood vessels. So now blood vessels, now this interferon gamma, it will converted, take these monocytes, it take that monocytes, these monocytes will converted into macrophages. Okay, these monocytes is converted into macrophages, then these macrophages will converted into activated macrophages. So it converted into epithelioid cells. So that and fused, these epithelioid cells fused each other. Some cells are fused each other to form giant cell. So this one is the giant cell. So first one is interferon gamma. Interferon gamma, this one is the activated macrophages form epithelioid cell and giant cell. Okay, so this one is presented in the center position, epithelioid and giant cell in that center zone presented. Second one is interleukin. Okay, the second chemical name is called, cytokine name is called as interleukin, will cause proliferation of T lymphocytes. Okay, it will form T lymphocytes. Then tumor necrosis factor causes proliferation of fibroblast. At the end, we will be having three cells, formation of granuloma. So here epithelioid cell and a giant cell in the center zone. Then second one is in that middle zone, this T lymphocytes. Then outer zone we having fibroblast. So this one is the granuloma. So poorly digested antigen enhelp, okay, to antigen presenting cell try to kill it, but unable to do so. So with the help of T helper, these T helper cells. So now what is the things it form activated? Okay, so it will take these monocytes out. Then after that, what it will do? What is this cytokine will do? Okay, this one will activate, will secreted chemicals. So this one is the blood vessels. Take in blood vessels, this name is called as monocytes. It will take out. After that, when it will reach to the tissue, that time it have that name. What is the name? Monocytes, macrophages. Okay, these monocytes will converted into macrophages. Now with the help of this chemical, this cytokine, it converted into activated macrophages. So these are the things cytokine. When it come, these monocytes, with the help of these cytokines, it converted into that interferon gamma, means epithelioid cells. Some cells fused to form giant cell. Then in the case of interleukin 1 and 2, means it form T lymphocytes. In the case of tumor necrosis factor, means it form that fibroblast. So this one is the center part, this one is the middle part, this one is the outer layer. There's a fibroblast presented in that outer layer. This is the granuloma formation. We know acute inflammation means 11 process, 6 and 5 vascular and cellular event is presented. Here 3 steps only, engulfment by macrophages. So that macrophages engulf that antigen, try to destroy it, but can't, because poorly degradable. So the antigen presenting cell fail to digest and degrade that antigen. This is the first steps. So second one is activation of CD4 T cell. That means it need help of T helper cells. So macrophages failed to deal with this antigen. So present antigen to with the help of CD helper cells. Okay, it will activated that lymphocytes activator releasing lymphokinase, some chemicals. What are the chemical? Interleukin 1 and 2, interferon gamma, then TNF factor alpha. Then what are the third steps? That release of cytokine, that interleukin 1 and 2 proliferate of more T cells. Interferon gamma activate macrophages and transform it into epithelioid cell. Interferon gamma promote fibroblast proliferation. Then composition of granuloma. Venous, it form epithelioid cell. Some epithelioid cell fused to form giant cell, then lymphoid cell, then fibrosis and necrosis. So epithelioid cells, what are the things? In bone marrow, it have that name monoplast. In blood vessels, it have that name monocytes. In particular organ, it have that name macrophages. That macrophages, after that, when that chemicals will secreted, that activated, that time name is called as activated macrophages. That activated macrophages name is called epithelioid cell. So epithelioid cells are cells. Epithelial cells like appearance, gel like appearance. Okay, this one gel like appearance, activated macrophages, vesicular and light staining. Then cytoplasm here is abundant, then pale staining with hazy outline, then weakly phagocytic. This one is the weakly phagocytic. This one is what is epithelioid cell? Activated macrophages. So light staining, here cytoplasm is abundant. This one is weakly phagocytic in nature. This is all about epithelioid cell. What is giant cell? Here fusion. Okay, fusion of adjacent epithelioid cell. Some epithelioid cell fused, so form multinucleated giant cell. It having 20 or more nuclei. Then that giant cell having four important types. One is foreign body giant cell, Logan giant cell, then Dorden giant cell. Fourth one is giant cell in tumor. So what is foreign body giant cell? This is the diagram. This one nucleus, no fixed arrangement. Okay, not fixed arrangement. Nucleus is scattered everywhere, so it is presented in everywhere. This one name is called as foreign body giant cell. Second one is this Lorgan giant cell. This one two way that nucleus is presented. Okay, so nucleus at either periphery. Okay, it is presented in periphery with two-third ring. Okay, so this one look like a horseshoe, or they are two pole, now north pole and south pole, like that presented. So this one name is called as Largan giant cell. Third one is Torden. So here in the cytoplasm, these are the vacuoles. In the cytoplasm, these are the vacuoles. In this okay, that vacuoles in that cytoplasm, here vacuoles is presented in that cytoplasm. Nucleus is forming a circle. Okay, nucleus is forming in a circle. The nucleus is forming a circle. The nucleus is forming a ring at the center. Okay, it form that nucleus form ring at the center, multiple nucleus. It is known as Torden giant cell. Torden's giant cell. Apart from which we are having giant cell of tumors. Okay, tumors. Anaplastic tumor giant cell, Reed Schadenberg cell, osteoclastic giant cells of bone tumor. So what are the that epitheliate cell fused to form giant cell. Four type of giant cell. Foreign body giant cell. Here that nucleus is scattering, not particular arrangement, no fixed arrangement. Second one is Lorgan giant cell. This one two-third ring is presented like a horseshoe, or north pole and south pole is present. Then Torden giant cell. Here that nucleus in that center it form a ring like, okay, center multiple nucleus, it form a ring, it is known as Torden giant cell. Then giant cell of the tumor. Foreign body giant cell, Lagergan giant cell, Torden giant cell. Then this giant cell, okay. Fourth one is giant cell in tumor, anaplastic cancer giant cell. Example, carcinoma of liver, various soft tissue sarcomas. The giant cells are not derived from macrophages but are formed from neoplastic cell. Next, type of granuloma. Okay, four important type of granulomas: immunological and non-immunological granuloma, infective and non-infective granuloma, caseating and non-caseating granuloma. Then special form of granuloma. Special form of granuloma, example, neccated granulomas. Then stellate granuloma. This neccated granuloma not surrounding a ring of mononuclear cells. This stellate, it is typically seen star-shaped granuloma. Granuloma with center neutrophilic infiltrate. So immunological granuloma, it have this one is the lymphocyte mediated. Immunological one is lymphocyte mediated. This one not associated with the lymphocytes. Example of immunological granuloma: tuberculosis, leprosy, cat scratch disease, plastomycosis, histoplasmosis. Non-immunological granuloma, silicosis, foreign bodies type pneumonia. Second type, infective and non-infective granuloma. Infective granuloma, example, tuberculosis, syphilis, histoplasmosis, coccidioidomycosis, cat scratch disease and plastomycosis. Non-infective granuloma, Wegener's granulomatosis, sarcoidosis, rheumatoid arthritis. Then caseating or non-caseating granuloma, caseous necrosis will happen on that one. Caseating granulomas because of tuberculosis, histoplasmosis, syphilis, coccidioidomycosis. Non-caseating, here also tuberculosis, sarcoidosis, Hodgkin's lymphoma, Hodgkin lymphomas. Special type, we know already, neccated granuloma, stellate granuloma, then thorax granuloma. Then example of granulomatous inflammation. What are the example? Bacterial disease, fungal disease, protozoan and some miscellaneous. We important things here. Center we have epitheliate cell and giant cell. Middle we have T lymphocytes. Then outer layer we have fibroblast. Some cell here necrosis. Some cells having necrosis at the center. Necrosis happen means soft granuloma, not occur means hard granuloma. So okay, that one is the important point. Sometimes Okay, necrosis takes place at that center, name is called as soft granuloma. Sometimes it does not takes place, it is known as hard granuloma. This is all about chronic inflammation. Three things is important: inflammation, tissue injury, and attempt at repair. Here, A granulocytes, we are discussing monocytes. It is presented in bone marrow, name is called monoblast. In blood means monocytes. In particular tissue means macrophages. Then because of cytokines, it become activated. That time name is called modified macrophages or epithelioid cell. Some epithelioid cell fused form giant cell. And different human organ having different modified macrophages. This one is the list. So three things only important: granuloma, inflammation, antigen presenting cell not killed by antigen, the antigen not killed by antigen presenting cell, it need T helper cell, it will secrete cytokines. So end of the section we have three different type of cell: epithelioid, T lymphocytes, and fibroblast. So this one is the granuloma formation. Necrosis happen means soft granuloma, does not means hard granuloma. So enhancement of macrophages not happen, so after that activated CD4 cells, then it is releasing chemicals. So after that release of cytokines, then composition of granuloma, we knows that three cells, important cells, along with that necrosis will happen means soft granuloma, not happen means hard granuloma. So what is epithelioid cell? Activated macrophages name is called epithelioid cell. This one is cytoplasm is abundant, light staining, weakly phagocytic in nature. So what is giant cell? What are the types? Type of granulomas. Thanks for watching.